Assalamu alaikum. Hello everyone. This is Arman. So today I am discuss about the viscera of livers and gives a demo within this organ. This is viscera of liver, or this is specimen of liver with gallbladder, inferior vena cava, ligamentum venosum, and ligament falciparum ligament, and ligamentum teres. Now we are going to be talking about the anatomical position. Right lobe is larger than left lobe. Right lobe is higher level than left lobe. Okay. The group for inferior vena cava is sliced posteriorly, and it's directed vertically downwards. Okay. The fossa for the gallbladder is lies inferior surface. This surface is directed downwards and backwards and left of the liver. Now we're going to talk the location of this liver. Location of liver. The liver is located on whole of the right hypochondrium, then greater parts of epigastrium and partly in the left hypochondrium, upper part of the right lumbar region. এই হচ্ছে আমাদের লোকেশন। এখন হচ্ছে আমরা বলবো what is the weight of liver. The liver is around 1.4 kg to 1.8 kilogram in males and 1.2 kilogram to 1.4 kilogram in female. It is like a wedge shaped. The liver have five surface: anterior surface, superior surface, posterior surface, right lateral surface, and inferior surface. It has two broad border, prominent inferior borders, and the superior surface, anterior surface, and right lateral surface are separated by a borders which is not defined. Now we are talk about the relation of livers, visceral relation of the livers. In esophageal relation, the upper part is related to the esophagus, and the inferior parts of left lobe is related to the fundus of the stomach, and this is pylorus attached to the pyloric part of the gastric, and renal flexures relations. It has seven impressions: suprarenal, right suprarenal impression, then right renal impression, right polyflexor impression, and duodenal impressions, pyloric impression, gastric impression, and esophageal impression. Okay. The livers is covered by Glison's capsules, which is a connective tissues layer, and it is covered by peritoneal cavity, which is called mesothelium, and the mesothelium is a simple squamous epithelium. The area which are not covered by the peritoneum, or which is devoid by peritoneum, is called bare area. The bare area contains about the bare area loop for inferior vena cava, chordate loop, and fissure for the ligamentum venosa, and fossa for the gallbladder. Now we are talking portahepatis. What is portahepatis? A deep transverse fissures about 5 centimeters inferior surface and the right lobe of the liver is called portahepatis. Boundary of portahepatis, it's bounded anteriorly by the chordate loop and posteriorly by the quadrate loop, and right by the neck of the gallbladder, and left by the meeting point of ligamentum teres and falciparum and ligamentum venosa. The portahepatis. Some structures are enters and some structures are emerged from the portahepatis. Structures enters into the portahepatis are hepatic artery, portal vein, hepatic artery, and hepatic nerve plexus. The structures emerge from the portahepatis is portal vein and some hepatic plexus. The relation of the portahepatis is called hepatic duct, right and left branch of the portal vein, right and left hepatic artery. Okay. The blood supply of the livers is hepatic artery, hepatic vein, portal vein. That's it.